Hello, my name is Karen Blankenship, and I'm a doctoral student at Florida Atlantic University and active nurse practitioner. You can find my blog on the web at healthycomm.net. This is the final educational session in a series of 6, and the title is Calcium and Bone Health. We learned in our last session that the supply of calcium to the bones and to all cells is facilitated by the adequacy of vitamin D intake. The failure to maintain adequate bone mass in the body contributes to osteoporosis, a major medical malady for an estimated 44 million Americans, 55% of those 50 years and older. Osteoporosis is most associated with bone fractures. However, it is also extremely painful and, when associated with kyphosis, affects several basic functions including eating and breathing. Mortality is also quite high, especially in those who sustain hip fractures. Osteoporosis affects women typically at an earlier age than men. Trabecular bone is impacted more than cortical bone, which is why fractures of the hip, vertebrae, and/or wrist are most common. The condition is also more prevalent in those who take certain medications, especially corticosteroids. To have good bone mass and avoid osteoporosis, adults must maintain good intake of not only calcium and vitamin D, but also protein and other micronutrients such as phosphorus, vitamin A, vitamin K, magnesium, iron, zinc, and copper. Bone mass is measured by passing a small amount of radiation through a bone to determine the ability of the bone to block it. Dual energy X-ray absorptiometry scans are most often used in clinical settings to measure bone mass and do not pose much of a health risk. The bone scanned by the DEXA receives about 1/10 of the radiation as that received from a chest X-ray. Bone information from DEXA scans is used to generate a T-score, which compares the scanned bone density to the bone density of a reference person of the same gender with peak bone strength about at age 30 years. T-scores ranging from 0 to -1 are normal, whereas scores that are -2.5 or lower indicate osteoporosis. Significant bone loss in a young adult is considered a decrease of 1.5 inches. How can you prevent osteoporosis? First, meet nutrient needs for calcium, vitamin D, protein, and other nutrients listed above. Osteoporosis essentially begins in childhood and continues into adulthood. Thus, it is vital for persons to build the greatest bone mass that they can, beginning in childhood and through early adulthood, before bone mass peaks at about 30 years of age. This is not to say that after 30 years of age we can forget about our bone mass. We need to maintain our bone mass, not lose it. Secondly, since hormones of regular menstruation provide good bone maintenance, see a healthcare provider for menstrual irregularities, as may occur with females who have anorexia nervosa and with athletes. For older women, estrogen replacement during the start of early menopause may help diminish the bone loss that normally rapidly occurs during this time period. However, because estrogen and hormone replacement have been linked with increased risk of cardiovascular disease, strokes, and cancer of the breast and ovaries, their use should be limited. Thirdly, increased muscle mass from weight-bearing exercises is associated with greater bone density since muscle keeps tension on bone. Thus, resistance-type exercise such as weightlifting at least 3 times weekly is recommended. And remember that smoking decreases estrogen in the blood in women, therefore decreasing bone mass. So try to quit smoking or at least reduce cigarette use. Alcohol use can also be detrimental to bones, especially chronic consumption of excessive amounts of alcohol. Additionally, because of alcohol appears to slow bone turnover and negatively impact the work of osteoblasts, which are the bone-building cells, alcohol consumption by adolescents and young adults may increase the risk of developing osteoporosis in later life. The effects of moderate alcohol consumption on bone health in adults are contradictory, but most studies generally show few to no benefit from alcohol consumption on bone health. So, for bones, it is probably best to minimize or refrain from alcohol use. An adequate intake of protein is also important for bone. However, the need for protein is somewhat dependent on adequate dietary intakes of vitamin D and calcium. As long as calcium and vitamin D intake are not deficient, protein is beneficial to build the bone. However, if calcium and vitamin D intake are inadequate, bone loss can occur with high protein intake. Finally, a healthy diet providing all nutrients in adequate amounts goes a long way in maintaining bone mass. Adequacy of the diet is important, as excess dietary intakes of some nutrients, such as sodium and vitamin A, as well as excess consumption of foods and beverages high in protein, can negatively impact calcium balance and/or bone directly. How much calcium do we need each day? According to the Institute of Medicine's 2011 report, and based on bone health, the recommended dietary allowances for calcium range from 700 to 1300 milligrams a day for all groups at least 1 year old. Remember, too, that the absorption of calcium is dependent on adequate vitamin D status. Therefore, it is also important to ensure an adequate intake of vitamin D, that is 600 international units daily for individuals up to 70 years of age, when 800 international units are needed daily. Milk, yogurt, salmon, sardines with bones, clams, oysters, and calcium-fortified orange juice, bread, and cereals are all good sources to build and maintain bone mass. Leafy green vegetables also provide relatively high amounts of calcium. Milk and yogurt provide 200 and 400 milligrams of calcium per cup. Cheeses provide 100 to 200 milligrams of calcium per ounce. 1 cup of fortified orange juice is 300 to 500 milligrams. 3 ounces of sardines with bones contain up to 400 milligrams. 1 slice of calcium-fortified bread is 150 to 200 milligrams. Turnip, mustard greens, broccoli, cauliflower, and kale contain 30 to 80 milligrams per half cup. Tofu contains about 125 to 227 milligrams per half cup. Kidney, pinto, and navy beans contain 64, 79, and 126 milligrams per half cup in that order. An ounce of almonds provides 75 milligrams, walnuts 28 milligrams, pecans 20 milligrams, and peanuts 15 milligrams. Studies examining the effects of different food sources of calcium on bone are conflicting. Sani and others reported that the final Framingham Offspring study found that milk and yogurt consumption are associated with higher bone density than cheese consumption. The authors predict that cheeses of high sodium and polyphosphate content may be less advantageous to bone density. However, not all cheeses are high in sodium. What calcium supplements are available if I cannot get enough from diet? The 2 most common supplements are calcium citrate, which is beneficial for those who have limited gastric acid production, and calcium carbonate, with possible side effects of constipation, gas, and/or bloating. The source of the supplement should be considered. If the calcium carbonate is from oyster shell or dolomite, it may be contaminated with aluminum and lead and should not be consumed. Bone meal with lead should not be consumed. When taking a calcium supplement, ingest up to 500 milligrams calcium per dose. It is also best to keep total calcium intake from supplements at no more than 1,000 milligrams per day. In other words, try to incorporate some calcium-rich food in your diet and not rely totally on supplements to meet your calcium needs. Are there any risks from getting too much calcium? According to the Institute of Medicine, the tolerable upper limit for calcium now ranges from 1,000 milligrams a day for those 1 day old up to 3,000 milligrams a day for those at 9 to 18 years old, then 2,500 milligrams a day for 19 to 50-year-olds, and 2,000 milligrams a day for those age 51 years old and above. Too much calcium can result in hypercalcemia, vascular and soft tissue calcification, hypercalciuria, and nephrolithiasis. Too much calcium from supplements can also inhibit the absorption of some minerals, such as iron, and can promote constipation. Where we are now aware of foods that build healthy bones and bodies. We also know how to eat for prevention and reduction of chronic diseases. We understand fortification of foods, supplements use, toxicity, and the reading of labels. Do we choose 4 ounces of cold water fish twice a week? And do we fill half of our plate with fruits and vegetables? The mind is probably the most powerful tool in existence. Let us use our minds and newfound nutrition education to build our personal health and to spark the involvement of others. Remember, we're building a community, and it takes each one of us to do the altruistic promoting of healthy eating choices for our family, friends, and associates. This altruism that activates the same pathways in the brain as sugar, but without the negative side effects, is the addiction we endorse. Enjoy your food. Be satisfied, but eat less. Thank you for your support, and let us continue to support others, cheering you onward to create health, reduce chronic disease, and to achieve an ideal weight. I want to thank you for watching and invite you to read the corresponding articles at healthycomm.net.